When we entrust our elderly relatives to the care of others, we assume that they will be treated with respect and dignity that they deserve.
Sadly, this wasn't the case for 89-year-old Edna Slan, who was filmed so hungry she was forced to beg for food.
I'm bloody starving. There's kids bleeding starving here.
Yeah, you'll get something
It's
soon.
not me at all, this isn't.
No.
Well, Edna's daughter Linda joins us today, along with care home expert Deborah Stone, and welcome both of you. What made you pick? It's Grantley Court was the name of the care home. Why pick that one?
I didn't pick it. It was identified that my mum needed to go from a residential home to a nursing home because of she was in a wheelchair and I had arthritis. And I was advised by Surrey County Council that this was the only bed available, even though it was out of area. So I had no choice. And you trust what they tell you, that it's, you know, that's the place to be.
And you were very happy with the care home that she was in before?
Oh,
it
yes,
just got
completely.
to the stage where
they
she
couldn't
needed
meet
too
her
much
needs,
care.
exactly, yes. She needed then to be in a nursing home.
And just how long was Edna there then at Grantley Court before
10
you
weeks.
realised a difference in her behaviour and indeed her appearance?
It was quite gradual. I mean, looking back, there were odd little marks and you know, things like that that you sort of think, oh, OK. The weight loss we didn't really notice because, again, you see her a lot, you don't necessarily notice it until you see a picture of time before and you think, oh. But the first time we noticed we thought there was something serious was when I got a call from Epsom Hospital to say that my mum had been admitted. The care home didn't tell me. And that she'd sustained injuries to her face and she needed 10 or 12 stitches in her head.
We've actually got a picture of that, and I should warn you that it's a very distressing picture if there's any little eyes that you just want to distract for just a second here, because it is an extraordinary picture. Here it is. These are the dreadful injuries that she sustained, and to this day you don't know how it really happened.
No.
And what did you think when you saw her like that?
I mean, I was horrified, to be honest. And we did ask what had happened, and they said she fell out of her chair. To be honest, it's impossible. It would be impossible for her to fall out of her chair because the way she was sitting, she couldn't have done so. We don't know, and we'll never know, I don't think now. There were no records kept that we were aware of, and we just don't know.
Well, then she went back to the care home.
She did, yes. Yeah, and then a couple of days after that, I think the hospital flagged up with the CQC, the Care Quality Commission, that there might be an issue because obviously the injury, nobody could really explain it. The next I was aware that I got a call from them to ask permission if they could speak to Mum because they'd obviously gone in there and seen her bruises and that sort of thing. I said yes. Didn't really think any more of it, if you like, and then the week after that, or 10 days after that, I got a call from the NHS because my mum is NHS continuing healthcare funding, and they advised me that any people that they funded, they were removing from Grantley as soon as possible, and that's in fact what happened. She was moved out at the end of September.
When did Becky make that video of essentially a starving woman?
Yeah. She made that on the 21st, I think it was the 21st of September.
This is your granddaughter,
yeah.
isn't it? And she went along to see her and recorded
She did,
this.
yeah.
Did she record it as evidence?
No. What tended to happen was, because I work a lot as well, we tend to try and go separately so that there's more people obviously going to see Mum. And sometimes Becky would record it to then show me, and she was particularly distressed this day, because obviously my mum was, you know, starving, and so she recorded it really to show me. And I think the worst thing about seeing that back now is because Mum has dementia, not very bad dementia, she always knows us and things like that. I think at the time we tended to think, oh, it's because she's forgotten that she's had something to eat. But actually everything she said in that video was true.
And the weight loss was proving it, obviously, yes.
And so I think that's what makes it harder for me, because I didn't dismiss it, but you didn't think anything of it until now you realise.
Well, In 2014, the CQC found that the residents of Grantley Court were at risk of acquiring infections because the home and equipment were not clean to an appropriate standard. There were not adequate systems in place to reduce the risk of infection. It failed all other standards, including treating people with respect, providing care, treatment and support that meets people's needs, caring for people's safety, protecting them from harm, staffing, the quality of suitability of its management. And in July 2013, the care home had failed to meet 4 out of 5 key standards, including assessing and monitoring the quality of the service.
That was January.
So you know, ongoing here and closed down now. But she was then taken to another home. Which you say the care that she's getting now is like being in the Savoy. It's amazing. So amazing.
Yeah.
But they did a body map.
Yes, the day that she actually went there, the 30th of September, they I think most nursing homes do. They do a body map so that any wounds, any injuries, I guess, you know, just to check. They completely do a top to tail. They asked me if they could take photos as well because my mum still had the stitches in her head that should have been removed 10 days prior. So that became even harder. So that was another thing to do. And they said to me, did I realise that Mum had a very nasty wound on her foot? And I said, no, didn't know anything about it. It turned out to be a grade 3 pressure sore, which is down to the bone. And when a nursing home, you know, there is a pressure sore there, they have an obligation to advise the CQC to report it as a serious injury. This was never done.
But this is also ongoing now because
yes,
this will probably end her life.
No, it will do. It will do. It had become so badly infected that she went into hospital for intravenous antibiotics because the other ordinary antibiotics had sort of stopped working. And I received a call from the hospital to say that the only way to stop the infection would be to amputate below the knee. Because of her significant weight loss, she wouldn't survive. And to be honest, I wouldn't want to put her through that, but she wouldn't survive anyway. So she's now on end-of-life palliative care. And where she is, you know, she's not in pain, she's comfortable. The hospital said it won't be days, it could be weeks, it might be months. We're 2 months down the line now. You know, that's, yeah, the picture there is how she is now. You know, she is on obviously very strong painkillers, but she's as comfortable as she can be.
Of course.
How do you prevent this from happening to a member of your family?
Well, it's very difficult, and I think, as Linda said, it's very difficult when you're in that situation to really know what to do and to complain or know what the truth is and what the truth isn't. But I think it's fair to say that in all cases you do have choices, and the important thing is that you should go and see care homes if you can before you accept it, even if the council is saying to you that's the only place that you can go to.
What do you look for?
Well, I think there's a number of things you can look for, not just how it looks itself, you know, if it's clean, if it's tidy, there aren't cigarette butts from the staff around the, you know, the back or whatever else, but also what does it smell like, you know, does it smell clean, and how are the staff? And importantly, does the home to you seem as if it's run for the benefit of the staff or the benefit of the residents? So do they smile, do they talk to you, do they stop and take time to talk to you? And one of the other things we recommend on the website is that you come in and visit the home at odd times, so visit at meal times, so you can see whether, you know, whether people are being helped with food if they need it and so on. Talk to the residents themselves. Do they seem happy? Do they think there are activities and things like that? And also talk to them about what their complaints procedure is and whether or not they have committees for relatives and staff to sit on together, because they should have that. And if they're negative about that, or, you know, they're not prepared to answer it, then I think you should worry about that, because it should be an open book. You know, they should be saying to you, yes, we do have that, and of course you can put in your views, and, you know, that could be anything from, you know, activities, and are we having, you know, anything other than bingo or something like that. But I think it's very important. And then it's also very important to realise that you do have complaints procedures beyond that. So, as Linda's mentioned, the CQC, you've also got the Ombudsman that you can talk to. Even the Citizens Advice Bureau will help you in terms of, you know, planning what you want to say and how you want to say it. And I think the important thing is it's a very emotional situation, and ideally you don't want to be emotional. You want to stay calm, and you want to be factual, and you want to say, look, this and this is concerning me, or I've seen these problems with my mother, or whatever, and you don't let go of it. I mean, you shouldn't just assume because somebody is older and possibly has dementia or whatever that they're not able to tell you the truth, because in the majority of cases they are.
Well, what's most shocking about all of this, like you said as well, Linda, you trust what these people are telling you. These places just shouldn't exist. With all of these organisations looking out for it, how on earth did this place get to be that bad?
Well, it's an impossible one to answer, isn't it? I mean, it should be regulated by the CQC. It should be inspected, and
which
you're
eventually
right.
it was.
Eventually it was,
Yes.
but not at the time. And so it's a question of, are they being inspected as regularly as they should be? Are the right people looking at them? Are they looking for the right things?
Yeah.
As we always say, I mean, there are many fabulous care homes with
Absolutely.
incredible care and caring staff, but it is just rooting out these rotten apples. A former care home worker who we won't name said, "I worked for many years caring for the elderly and saw some truly shocking things, including carers tying residents to chairs. Absolutely disgusting." Another says, "This is why I don't work in care homes anymore." So there are obviously still some out there. Surrey County say, "We're sorry to hear about this. We moved Edna to the home in June before Health Services took responsibility for her care a month later. And at that time, it had passed an inspection by the national regulator, CQC." I think you've got Sutton Council
Sutton
there.
Council says our concerns were confirmed with the first and second CQC reports. In December, we were alerted to alleged injuries suffered by former residents while they were at the home and immediately notified the police. That's Sutton Council.
Thank you very much indeed.
Thank you very much.
Thank you very much. Thank you, ladies.